The honourable member for Gilmore.
Deputy Speaker, despite the fact that the federal government doesn't employ any nurses, I welcome this motion before the House and note that the Shadow Minister for Health has already left the chamber. I also note the member for Throsby's inaccurate assertion that no coalition members are present to debate the issue, while there are 8 on the other side and 21 over here. The impact of the government's wrong priorities. Excuse me while I choke. For several months now, I've been advocating for a practice nurse in a regional area, trying to find out why the previous government changed the rules, disallowing the possibility for a practice nurse, be quiet, to fulfil her applications for recent hours in the practice while working in order to renew her registration. Please don't snip at fairy-tale budgetary interpretation measures when it was the previous government that made this change, and regional practice nurses are one of the unintended consequences. Where was Labor and the Nurses Union when young nurses desperate to retrain and get back to work after having a child? How do they assist them to get back to work? The answer is they don't. No scholarships and no regional application of policies. Shame. Those opposite speak of health and nurses when previous Labor member announced extra beds in Tasmania, 2 wards were closed. To those opposite, I say, don't make me laugh. Labor doesn't care about nurses' regional health care. I welcome the chance to speak on this MPI because of the importance of health services in my regional electorate of Gilmore. Only yesterday I met with the Health Minister Peter Dutton to talk about health care in my electorate, speaking about issues like headspace, bulk billing, domestic violence services, counselling, MRI issues and more. We are one of the most healthcare critical regions in the nation, and that truth is something not to be proud but to advocate for them. I'm proud to say that on this side of the House we care about nursing and we care about healthcare. Deputy Speaker, in fact the budget papers clearly show there is no cut. Hospital funding from the government receives an increase for 3 years. In this budget, annual hospital funding increases by over $5 billion. Our commitment to total hospital funding to the states of almost $70 billion over the 4 years to come. In my own state, this goes to $5.9 billion in just 3 years' time. Those opposite go on about how one of their Kevin Rudd thought bubbles was to increase hospital funding by over 10% a year, every year. Such an increase would take our current $15 billion health budget to a $40 billion debacle within the decade. And because we're not following this stupid, unaffordable Labor funding thought bubble, those opposite refer to cuts. Is it any wonder that we were left with a budget disaster when first principle economics simply aren't understood? It was another Labor thought bubble with no actual thought, that no plan and no maturity, nor was there any accountability for this proposed expenditure. We're not cutting expenditure, we're just not spending imaginary Rudd dollars. I find it farcical that those opposite bring this motion before the House today, and yet the Leader of the Opposition is short on just how Labor would pay the pie-in-the-sky health plan. The Shadow Minister for Health never attempts to outline how Labor will find the nearly $15 billion a year extra they claim they can deliver for our hospitals. I guess they prefer the nurses to work in the dark because of the electricity costs. Gilmore has many district nurses, and those opposite even tried to destroy part of their income package by getting rid of the FBT, which was essential for regional nurses. It's not enough that regional areas were starved of funding and no accountability required, but those opposite introduced additional levels of bureaucracy. Where on earth does that equate to assistance for frontline nurses? We'll be heavily investing in our healthcare professionals, showing the respect they deserve, the increases to the practice incentives programs, an extra $40 million for additional medical internships, and an extra funding for the General Practice Rural Incentives Program, which actually gives nurses an increased chance to work. Deputy Speaker, we in Gilmore, especially through our Shoalhaven campus of the University of Wollongong, have an outstanding school of medicine, and that also of nursing. This university welcomes the changes to higher education and have confirmed that in a competitive environment it is in the students' interest and it's unlikely to have fee increases. Unlike those opposite, we know how precious our nurses really are, and we'll continue to support them, growing the economy so they can actually get a job.